I'm an implementation scientist, and the focus of my work is identifying how we can better improve how child obesity prevention services are implemented in the community. And the reason that I have an interest in this area is because there's a lot of science going in and a lot of investment going into identifying effective child obesity prevention programs, but there's not a lot of research being undertaken to identify how we get those programs into practice so they can ultimately benefit the community. And my research looks to identify how best we can do that. We've conducted a series of research trials over a number of years now where we've tested different strategies to implement programs in community settings, like schools or childcare services or sporting clubs. And what we've found is that through tailored but comprehensive implementation support, so the right training, the right performance feedback, the right monitoring and mentoring, that we can improve the delivery of obesity prevention programs in those settings, and we can do that at a reduced cost. So as one example, we worked with schools across New South Wales to support the implementation of a healthy canteen policy. So this was a policy that restricted the availability of unhealthy foods that were available and for sale in school canteens. And through a series of trials, we were able to double the number of schools that received the program for a fixed amount of cost. So we doubled the impact of that initiative. We've been really thrilled at the impact that this program of work has had. Locally, the work that we did in the Hunter New England Health District, where we conducted research to improve how obesity prevention services were delivered through community settings in that region, reduced child obesity prevalence rates by about 1% per annum over the life of the program. And that was in the context of obesity rates in children that were rising in other jurisdictions across New South Wales. But what was particularly exciting was that the New South Wales Ministry of Health took the core architecture of that child obesity program and the implementation research associated with it. That program was called Good for Kids. So took the core architecture of Good for Kids and adopted that for the delivery of child obesity prevention services across the state. This type of recognition and award and exposure is really critical for early career researchers to develop their networks and improve the extent to which they can engage other important stakeholders in their work, ultimately to improve the quality of their science and the impact of their research on the community.